Hello everyone. Today I would like to talk on a topic that I think is the most discussed topic in homeopathy. It is a topic that we come across a lot in our clinics, and patients, all the people around us ask us this question always, and that is regarding diet and regimen in homeopathy. आपसे अगर आप प्रैक्टिस करते हो तो आपसे हर बार पेशेंट, ख़ास तौर पर अगर वो पेशेंट पहली बार होम्योपैथी का इलाज ले रहा है, और या फिर कोई ऐसा व्यक्ति जो पहले ले चुका है बट आपके पास आया हो, आपने पूरी केस लिया, उसको दवाई दिया, और अंत में वो ज़रूर आपसे यह सवाल करेगा कि व्हाट कैन आई ईट डॉक्टर, मैं क्या खा सकता हूँ, मैं क्या खा सकती हूँ, मुझे क्या नहीं खाना चाहिए, मुझे क्या खाना चाहिए. And it is a question that leaves us perplexed. Why? Because what we have learned during our studies, what is mentioned in Organon, what our senior physicians who taught us, we have learned that there are so many things that should be avoided. There is a long list given in Organon. So what to do, what to advise to the patient? I will advise you that you make this decision to advise diet and regimen based on 3 criteria. What are these? The first criteria should be based on the patient. What is the disease that the patient is suffering from? For example, a patient is having diabetes. You should advise to do not take food, any food that is high in glycemic index, like rice, potato, any kind of direct sugar, any kind of fruit containing high amount of sugar. In case of thyroid patient, do not advise him to not take any kind of food that contain goitrogens like soya bean or cabbage. In case of dyslipidemias, advise patient to take high amount of HDL foods. Try to avoid any kind of food that contains any kind of trans fatty acid or saturated fats. If a patient is suffering from celiac disease, you should advise to not take any kind of food that contains high amount of gluten. Advise to not take milk or milk products in case of lactose intolerance. Such kind of advice. So the first thing you should remember that select or advise the diet and regimen based on the disease from which the patient is suffering. This we can easily do by our knowledge of practice of medicine, our knowledge of clinical medicine. The second criteria is based on the remedy that you have selected. Certain articles, certain food articles hampers in the action of that remedy. जैसे कि that like coffee, it affects the action of soranum. If a nux vomica or opium patient takes alcohol, it hampers in their action. There is a long list like that. Some says to avoid garlic, some says to avoid onion. There is a long list like that of various remedies that should be avoided, because they are incorporated in the materia medica, because our stalwarts, the doctors throughout the history, have experienced this, that certain food articles hamper action of a particular medicine, and they have verified it, re-verified it over the period of time. That's why they are given, they are included in the materia medicas. You should definitely keep in mind that. And third thing that you should keep in mind is to take the advice given in Organon. Let's look at the diet and regimen section. It starts from aphorism 259. So, what in 259 he tells Hahnemann, that considering the minuteness of doses necessary and proper in homeopathic treatment, we can easily understand that during the treatment everything must be removed from diet and regimen which can have any medicinal action, in order that a small dose may not be overwhelmed and extinguished or disturbed by any foreign medicinal irritant. So, what he basically tells is that any substances, because the doses that we are giving, due to their minuteness, certain food articles, especially which are medicinal in nature, can cause the hamper of the action of remedy, can produce hindrance, can act as an obstacle to cure. In the next aphorism, he writes that hence the careful investigation into such obstacle to cure is so much more necessary in case of patient affected by chronic diseases, as their diseases are usually aggravated by such noxious influences and other disease causing errors in diet and regimen, which often passed unnoticed. And then he tells a long list in the footnote of this aphorism. Things like any kind of spicy, highly seasoned food. He have said about the various kind of cheese, strong smelling substances, any kind of consumption of any kind of root vegetables like horseradish, garlic, toilet articles like soap, strong perfumes, tooth powders, all kind of spices, alcoholic drinks such as beer, wine, etc., strong coffee, strong tea, medicinal tea, etc. So, it is a long list that you can read in the footnote of this aphorism. Now, what the problem is, that in practicality, if you think, you cannot always follow these instructions. Hahnemann said that these are the things that can act as an obstacle to cure. But it is not often possible to avoid all these food articles, toiletry preparations, to avoid. तब हम क्या करें? The answer to this question was beautifully answered by Boninghosen, one of the contemporaries, you can say, or a disciple of Dr. Hahnemann. What he said, he published an article in 1833 and he said about the diet and regimen, and the extract is given on the screen, you can read it. He said that experienced has proved that dynamization of drug have so much increased the intensity of the medicinal virtue that all grossly material influences can affect it but little or not at all. So some amount of laxity in dietary may be allowed now. In chronic cases, patients are forbidden beside the actual medicine of all kind, only coffee, strong tea, heating drinks, spices, strong odor, especially camphor. So what he has said, that because of the dynamized nature of our medicine, after potentization, majority of these material influences does not usually affect the action of our medicine. And this we see that our medicine act unconditionally. In majority of cases, we observe this in our clinics, that patient who drinks, who eat any kind of like pan masala, any kind of take any kind of narcotics, who have any kind of sedentary habits, in all over India and in subcontinent countries, we eat a lot of spices in our food. Certain states, for example in Karnataka, Malabar region, coffee is grown in abundance, and the people there and all over the India, many people drink a lot of coffee. But still the medicine acts because it is potentized, dynamized. What he has said also in the last line, that certain articles, like especially in patients who are chronically suffering, who have chronic disease of any kind, certain things like strong coffee, camphor, camphor and strong coffee, any kind of coffee actually, is considered as a universal antidote. If you have knowledge of materia medica, you know this, that majority of medicine, almost all medicines, can be antidoted by coffee or camphor or any strong smelling substances. I have observed this, and you might have also, that people who drink alcohol, who take wine or any kind of alcohol, you find that especially in chronic cases, your medicine action might not be that long or might not be that good as you want it to be. So these are certain things that should be avoided at all cost. You can advise the patient if he has any kind of addiction, at once you cannot tell him to stop, but you can advise him to take a step in the direction of lowering his addiction. Try to minimize any kind of addiction he has with wine, smoking, any kind of pan masala or any kind of narcotic he is taking. So this can be done. And now many times certain patients ask this, okay, in homeopathy we have heard that we have to take a lot of precautions, lot of dietary restriction has to be there. Certain people say that can we take sour food, can we eat onions, can we eat garlic, can we put asafoetida in our food? So Hahnemann, some doctors still they advise a lot of uh, these things to be avoided, which only makes the life of the patient difficult. He writes in the footnote of aphorism 260 that some of my disciples seem needlessly to increase the difficulty of the patient dietary by forbidding the use of many more tolerably indifferent things, which is not to be commended. He tells that उनके कुछ disciples हैं, ये उस वक्त की बात कर रहे हैं, और आज भी ऐसा होता है कि कई लोग ज़रूरत से ज़्यादा भी परहेज बताते हैं, which only makes the life of patient difficult, क्योंकि वो क्या क्या चीज़ें अवॉइड करेगा. Your medicine selection, if it is accurate, if the potency is correct, it will act unconditionally. We all use soaps, we all use toothpaste, we all use spices in our diet, but still the medicine works. But certain universal antidotes have to be definitely avoided, like coffee and camphor. Any strong smelling things, alcohol should be avoided during the treatment especially. Now the fourth thing that I want to mention is regarding his mention of acute diseases. What to do in acute diseases? He writes in aphorism 262 that in acute diseases, on the other hand, except in cases of mental alienation or subtle, unerring internal sense of awakened life preserve faculty determined so clearly and precisely that the physician only required to counsel the friend and attendants to put no obstacle in the way of this voice of nature by refusing anything the patient urgently desires in the way of food, or by trying to persuade him to partake anything injurious. इसके कंटिन्यूएशन में फिर आगे भी वो लिखते हैं that desire of the patient affected by acute disease in regard to food and drink is certainly chiefly for the things that give palliative relief. They are, however, not strictly speaking of a medicinal character and merely supply a sort of want. तो वो क्या एक्सप्लेन कर रहे हैं कि certain times in acute diseases patient have certain desires. For example, a patient who is suffering from continuous diarrhea because he is dehydrated, he desires sort of juicy things. He may desire a lot of salty things to replenish all the water and all the electrolytes, all the salts. A patient of aconite may desire cold water. A patient of bryonia desires a lot of water. If he is natromure, there is constant unquenchable thirst. And in cases like that, that desire should be fulfilled in moderate amount by the attenders, because that will give the palliative relief. He mentions further that any kind of the comfortable environment should be made, like the temperature of the room, like the bedding, any small things that the patient desires, wants at that time can be given, even if that article can cause slight hindrance in the action of medicine. That can be given, because the medicine, because it is potentized, will often overcome that hindrance. Usually that is not the case. He had given an example in the footnote, like in case of aconite, certain vegetable acids aggravate that patient. But usually aconite desires just cold water, nothing else. But even though sometimes if he has something that he desires that can hinder the action of medicine in acute case, you can usually give it. because that hindrance will usually be covered by that dynamized medicine. So read the aphorism 263 carefully. The slight hindrances that the gratification of desire within moderate bounds could oppose to the radical removal of disease. Then he gives in the footnote that the example of aconite. Okay. Before that, in aphorism 261, he tells that in chronic diseases, what he writes, the most appropriate regimen during employment of medicine in chronic disease consists in the removal of such obstacle to recovery and in supplying where necessary the reverse, innocent, moral and intellectual recreation, active exercise in the open air, almost all kind of weather, daily walk, slight manual labor, suitable nutritious unmedicinal food and drink. So he writes that any kind of in any kind of chronic disease, certain things have to be done. Like the patient should be advised to take healthy food, not too much spicy, oily food. Should take a healthy homemade cooked food. Take slight exercise daily. Take a walk or do any kind of stretching, slight manual labor, do the household work. So Hahnemann was such a visionary that he knew at that time, so many years ago, that what are the things that are necessary to help the deranged vital force. Any kind of recreational activities, mild amount of manual labor, things like that. So all the 3 points you should remember while advising the patient for diet and regimen. First is regarding the disease process, regarding the patient, should depend upon the patient, should depend upon what the disease the patient is suffering from. Second, should be based on the remedy that you are prescribing. And third point, you should have the knowledge of what Hahnemann has said in the Organon. Things like strong coffee, tea, camphor, alcohol, how much you can avoid, you should advise patient to avoid that. Keep in mind the learning of Dr. Bonninghausen and what Dr. Hahnemann has said about the acute conditions. That will be it for today, and I hope you have liked the video. If you have, kindly press the like button, subscribe to my channel, and I hope to see you next time. That's all for today. Thanks a lot.